So hello, everyone. Good morning, good afternoon, good evening, good night to some of you. Thanks for joining at this time. I'm talking about today's important topic on patient safety and how that impacts the healthcare accreditation or healthcare accreditation impacts patient safety. I'm Wendy Danacourt, and I serve as the head of healthcare accreditation at American Accreditation Association, or as we like to refer to ourselves, AAA. It's a pleasure to be here with a group of professionals who share a commitment to raising the standard of healthcare, quality, patient safety, and overall wellness of individuals. We have a very diverse group of people. Now we're, oh yes, well over 100 participants here. So let's just do a little bit of housekeeping. Everyone should be on mute. If you have any questions, please put it in the Q&A. That is where I will be looking at for questions that we answer at the end of this session. And any questions that we don't get to during the session, we'll answer and we'll put it in the recording. We are recording this so that we can put it on line for further reference after that. So let me just talk a little bit about AAA. So the American Accreditation Association, we're recognized internationally. We are a U.S. entity and we provide accreditation worldwide. Our headquarters is in Virginia, and we do have international offices, including in the United Kingdom and London. We operate globally. Oh, I need to update this slide. We are now in 54 countries. Woohoo! It's very exciting how we're growing and making an impact on that. So our strategic objective really is to provide international accreditation that inspires confidence in the quality of services and acceptance of results from accredited organization, protection of health, safety, and environment to the public. Also promote the acceptance of accredited results or certificates internationally amongst global partners. We strongly believe that we want to see global accreditation around because it's not only looking at your immediate area, but we take the entire world, entire standards, best practices into consideration for our standards. And another strategic objective of ours is to continue to strengthen our own operations team, developing the capacity and capability to exceed the expectations of our customers and stakeholders, and deliver accreditation services to the highest quality and technical standards. Come on. So at American Accreditation Association, we not only do healthcare accreditation, which incorporates hospitals, ambulatory centers, and providers. We also provide accreditation for training and education providers, inspection body accreditation, school accreditation, laboratory, which is more of the diagnostic laboratory, and certification bodies accreditation as well. So we're very well rounded in the accreditation and areas that we provide. With healthcare accreditation, we are a member of ESQA, an international organization that gave us our certificate saying that our accreditation process is meeting their standard and we at an international level. And we worked over 30 years to improve healthcare quality, safety, global on that. And the standards that we've created ensure that your organization meets the highest health and social care requirements, allowing you to create greater trust and respect in your clientele and your patients on that piece. So why we believe that accreditation matters. The first one is really quality and patient safety, which we're going to be talking about today. But it also builds trust with patients, stakeholders. It enhances and improves staff training and performance. You gain a competitive edge in the healthcare industry, both financially and in reputation. And often is required to meet government or payer requirements on that. So again, just another slide to see why healthcare accreditation is important, improving outcomes, competitive advantage, enhanced operational efficiencies and performance. We like to really we do look at the entire system and make sure that you're not just collecting information, but you're using that information to improve. So that is a little bit about American Accreditation Association. So now you're going to have the wonderful opportunity of hearing from Antonia Vittori. I got to meet her over the past year. Wonderful person, very insightful in all the interactions that I've had with her. And I'm very excited to learn from her on this.
But yeah, it should be okay. So thank you, Wendy. So my name is Antonia. I'm currently based in Ireland, and I work as a compliance quality and safety manager for one of the organizations here in Ireland. So welcome everyone today. We will be talking about patient safety. That's why you're all here. And it is our patient safety week, so it kind of makes sense, right? So I'll be talking about patient safety and the importance of accreditation and how those two tie up together. So yeah, I'm going to walk you through our agenda. So next slide, Wendy, please. Great. Oh, that's moving very quick. Great. So today's agenda, I kind of broken it kind of into four areas. So we'll be talking about safety, what safety means, what is patient safety, and then importance of patient safety in healthcare, which you all know about. And then we're going to talk about growing expectations for quality and accountability and how really that ties up with the accreditation as a framework for continuous improvement. So we can start with safety. Oh, next slide, Wendy. So what really is safety? Just general safety in healthcare. I use this little, thank you. So I use this little backronym here, and I used S for sense the error, A, act to prevent it, F, follow the safety guidelines, E, inquire into incidents, T, take appropriate remedial measure, and then Y, just your responsibility and accountability. Next slide, thank you. So what really is patient safety and how can we define it? We can say that patient safety is absence of the preventable harm to a patient during the process of healthcare. I think that's the basic definition out there. And the discipline of patient safety is coordinated efforts to prevent harm to patients caused by the process of healthcare itself. Like I think we all agreed and we all heard about Hippocratic Oath. It kind of is generally agreed that just do no harm, simple as that means patient safety. Now there's so many concepts that goes into it, but I think we all agree, please do no harm would be the kind of sum it up what patient safety means. Yeah, you can move on to the next slide. So patient safety, what are we all trying to achieve here? We try to deliver safe, effective, and reliable care. I think we do agree that prevention of errors and adverse events in healthcare would mean, as a definition, what are we trying to not achieve? And the examples that we can use is medication safety, infection control, surgical safety, and there's so many others that we do. So we were talking about patient safety and what are the challenges, how do we define it, and the goal that we are trying to achieve here. So some of the challenges that you all might face, any examples there? Anyone would like to share any examples of the safety challenges they experience in their workplace, organization they work in, or just their career when it comes to patient safety?
Dima needs to take them off mute because they're all muted.
Okay, you can write in the chat box and then we can have a look at it. And I'll just go on with few. We have medication errors, miscommunication among healthcare providers, and I think that's the big one and where technology comes in handy, but it should be utilized properly. Hospital-acquired infections, surgical complication, patient falls. There's many more diagnostic errors, pressure ulcers. I think that's the big one as well. And consistency, I think you would all agree that trying to achieve consistency, across your departments and units and sites will be the big one as well. So that would just be some of the patient safety challenges, but I'm sure there's many more that you would be facing. Any Documentation, yes, that's the big one there as well. So thank you. And how to stay consistent with documentation, I agree. Um, so why patient safety is critical? So we're trying to prevent harm, reducing the healthcare cost, building trust, and supporting healthcare workers. Now, when we say preventing harm, protecting patients from preventable injuries, infections, and errors, that's what I presume comes to your mind straight away. Doing no harm, like we said in the beginning. Reducing healthcare costs, I think that's such a big one for me as I work in quality and safety department. Every time you try to do quality initiative, it's all about cost, and the board's not going to sign it off because it's either too expensive. So actually reducing the healthcare costs on another front, avoiding the unnecessary expenses related to errors actually might help you to get some initiatives across the line. Building trust with patients, with your staff, and making sure they're confident in the healthcare they receive and the staff, the healthcare they provide. That's a big one as well in achieving the patient safety. And supporting healthcare workers, quality systems, support your staff, your training to provide safe and reliable care. So, yeah, just one of the reasons why patient safety is critical. So, what are we trying to do? Like, how can we achieve that? We try to improve patient care on a regular basis, daily basis, even. We try to have patient-centered approach, and regardless the country you're in, I think that's the core, that's the base for everything that we do. We try to reduce the risks and learn from our mistakes, and I think that's the big one where organizations might not fail, but just have harder times to learn from the mistakes and systems they put in place to help them to achieve this and then be accountable. I find this one the most important one. And some of you might disagree with me, but being accountable and allowing to learn from your mistakes actually help you to move forward. And I think there's still cultures out there. I mean, cultures in your organizations, and I worked in some of them where there's still fear, there's still culture of fear, uh, secrecy, and not reporting things, not sharing and being transparent. And service like that will never improve. So being accountable and learning and sharing it with your staff members and sharing with the patients if the mistake is made is key to success. And I think you probably will all agree with me. So we are all facing, I love how my slides are just doing its own thing, but that's fine. We'll walk through them. Um, yeah, I'm just gonna let it all go through. We are facing real-time changing landscape of healthcare expectation. I think we're all part of the changing, how the world is changing worldwide, technology, and patient consumerism is increasing, or we are all focusing on values and not just service that's being provided or fee for service. An impact of technology and regulatory and policy changes. I think you would all agree that these four would be kind of the main ones, what we are facing at the moment. You probably have more patients coming into your hospitals, that the patients are more informed and expect healthcare to be as convenient, as personalized, and other services. I do notice in my line of work that everyone's more informed, families, their loved ones, everyone's seeking their rights. And I'm not saying that as a bad thing. People are just generally more informed. There's an internet out there. There's it's easy to Google things and they know their rights and they will, I'm not going to say they'll demand them because they do have rights, they deserve this, but it's definitely easier to be aware for everyone, elderly and the young ones coming to our facilities than it was 20 years ago. And it's just what it is. And so, how do we accommodate this? Focus on outcomes and value. Like, there is a shift, and I think you would all agree, fee for service. Like 20 years ago, I'm not going to say that we were delivering basic service or just a service and they were patients and paying for it. But there is a shift in the mind. Like, we are all trying to do our best. We're all talking about person-centered care and the highest quality of care. And I think we're using that language more now than we were using it 15, 20, even 30 years ago. And it's all about quality. And even your regulatory bodies and national bodies, they're all enforcing these quality initiatives. And even accreditation itself, it's all about quality initiatives and giving the best possible care that we can deliver. Impact of technology. I mean, I love technology personally. Everywhere I worked, I'm like, it's all about technology. Let's get these tools in, and it is a great way. It's truly, it was like life changing for every service that I worked in. And getting the data is quicker, following the data and actually making the informed decisions much quicker than it was before. Tracking the patients between the departments and having the electronic record. I mean, I think you all agree. And I still like, I have touch with the services that I keep in touch with services that are still like paper-based, and that's fine. That doesn't mean that they're like falling behind, but that just means that sometimes they're just working a bit harder to get and to do what we can actually do with the digital tools quicker. Um, Reports and getting the data together and actually seeing the trends with the digital tools, it's like instant. It's within a second, and without it, it's just it takes a while. I would say it takes maybe a full day of work for someone to produce report. And I've been on both sides, so yeah, I think impact of technology has just been huge. And regulatory and policy changes, yeah, I think it's been a big push, at least in Ireland, where I'm based, national governing bodies on the policies and quality of care and what has to be followed. But I actually, if you're working in an accredited organization and if you're working in a non-accredited organization, there's still a huge difference. And I say this in a way that you're, at least here in Ireland, there is a difference when you work in a place that's just being regulated by the governing body. They will push for quality initiatives, but not as much as when you have your accreditation, when you're trying to pass your accreditation or just go through the cycle preparing for accreditation. They will ask you to produce quality initiatives. Like that will be part of their standards. And I think that makes the huge difference between accredited and non-accredited organizations. We all follow the national guidances and policies and the laws, but when it comes to quality initiatives and actually doing a bit more than others, I would say that's where the accreditation comes in handy, and it makes a difference. So I think that's also a big one, how to kind of navigate this changing landscape of healthcare expectations. So what are the current system challenges that we all face? Errors and system failures repeated, and errors are going to happen always. There's no bulletproof system. It's how do we minimize them? And even as a risk manager, like I always like to call it, it's not a positive risk that we take, but it's we are aware. You cannot just delete them from the sheet or your risk register, whatever. It's always going to be there. But what do you do to either prevent them or minimize them? And then system failures, having the systems in place, not being utilized, not being used properly. It's still it's not mine. It might not be the technical system failure that sometimes we could refer to, but it's also just not using the system properly, whatever the system is. Action on known risk is very slow, and I've seen this all over the places I worked. We all know the risk, but senior management team or someone out there just takes a while to action it, or and there's no reason, and put aside the budget and everything, we're talking about simple risks that could be dealt with in a days, and it's just people, even if they know about risk, it takes ages to actually act on them. And that will be the biggest system challenge that you face, especially when you know about them, when you're actually aware of the risks and just letting them sit there and do nothing about it. And I know there's so many factors that could contribute, but there were risks that I faced so many times, and it's just like matter of either communicating it down the line or just making something about it, and doesn't involve a budget. So being proactive, it's another way to work around it. Detection systems in the early stages. So you could have systems in place, but they're set up, they're new, they're just went live, they're in place, but the staff are not familiar, staff are not sure how to use them. It just takes time to embed something to kind of put in place, and it takes a while to kick off. And I've seen this every time we would do a new project or new system in place or whatever. If we change a provider or something, it takes a while for staff to get familiar and know about this. And it's all about how do you get closer to the people on the ground? How do you communicate this and make sure that through these early stages, they follow the systems? So yeah, that would be another one. And many events not being reported and understanding of cost is limited. Many events not being reported, and that's, for me, that's still an ongoing issue. We have systems, and I would say, oh, we have great systems in my place of work, but I do know there's still some events they're not being reported or they're reported retrospectively. So what do? You constantly train your staff, you constantly go around and do your best and try to communicate with people, send the memos out, and just raise the awareness. And it does help, but it takes a while. I can actually see I've taken my current role just not 3 years ago, but just about 3 years ago. And you can sense the change happen. Like, you involved so much into, you put so much into it. You're raising the awareness, campaigns, program, clinical and quality programs. And there was so much work put in. And even though you think every single month, oh God, like I'm still not seeing change, you take a step back in 18 months or 2 years now, you can actually see there's change. People, you did raise awareness, but it just takes a while. And next one, understanding of causes, limited, just knowledge and the awareness really. And sometimes even the people at the top, they do need advocates, they do need advisors to guide them and to help them when it comes to quality and safety. And you do have to have specialized people in place. And I think that's what's happening in Ireland now. It's becoming more and more, these hospitals and groups would have now people like compliance, quality and safety, risk managers, someone to take care of accreditation process, people that actually have experience in these areas that can actually help raise the awareness. Because I always, like, I never understood how can one person do, three people jobs. It's just, no one's perfect, no one knows everything. So it's just making sure to have dedicated people in place for certain areas. I think that really helps to help raise the awareness when there's an issues and the causes that created certain risks. And a few examples of successful scale up, your initiatives, like as I said before in a previous slide there, your accreditation, and I can say this, like I would say this in court, okay? I worked in places with accreditation and no accreditation. There is a difference. Quality initiatives are not pushed as much by regulatory bodies. At least I'm talking for Ireland, okay? Don't take me wrong, as when you have accreditation, because when you go for your accreditation and the standards that are there and that you have to follow and make sure they're in place will push you for certain quality initiatives. And that's what really makes your service grow and get better each year. And limited measurement of impact. Back to technology. I think technology really helps on this one. And it helped me certainly to monitor the risk, the cost risks, the data, the just patient safety data, and then come up with the trends and reports and quality initiatives. So yes, there's a way around it. I worked in services where I still had to do my job and there was no technology, and you do work your way around it. But then again, it's making sure that you have someone to do those things. And yeah, those would be the kind of the most kind of the key current system challenges to me. I'm sure you would have lots of other examples. Blame culture alive and well. It is alive and well. I actually agree with this statement. Blame culture is alive and well, and I'm not proud to say. Um, Everywhere I worked, it might not be in all departments, and might not be the all areas of work, but it is there unfortunately, and fear and defensiveness and secrecy. I think there's a change, there's an improvement. I think 5 years, 10 years ago, things were different. 5 years ago, things were different. I think healthcare is moving rapidly and growing, and people are more open. And I think 20 years ago, like we don't even have to talk about it. It's world looked different, healthcare looked different, regulatory bodies were probably not even in place, some of them. But yeah, I'm never going to forget, I was doing my risk management training in one of the places I worked, and I was just discussing reporting of errors and patient safety, and similar to this what we are doing today. And I noticed that medication errors are kind of on the lowest rate of reporting in the hospital that I worked. And I was like, is there a reason for this? Because mainly there were nurses on a call. And I was like, is there a reason for this? What are the challenges? Is it the systems, the new system in place that we put that people don't know? Is it a training? What really is it? And one of the nurses, she was really open about it, and she was like, "Oh, Antonia, but it stays on her file." And I was like, "What do you mean it stays on your file?" And she was like, "Yeah, if I do the medication error, I fill the form and it stays on my file." And I was like, I don't think so. It worked that way." And I just realized then that this was 20 years, this was maybe the practice 20 years ago, where they would maybe put these on file. Like, I truly don't know, but I really had to break it down and then bring it back to the senior management team. I was like, I think we should raise awareness here, like what really happens when you report an incident, an error, that it just goes into quality system and that's it. Like, that doesn't mean, I think there were culturally, there was a fear and they were afraid that that will be used against them in the new employment or when they go out there to look for the job. It was, it was kind of a mind blowing to me, but then I kind of, oh my God, like it's just what people believe, or maybe they experienced in a previous workplace, maybe these things were held against them. So it's just being open and transparent with your staff. And even when there errors happen, like we said in the beginning, learning from it, logging it, learning from it, and talking openly about your staff, it kind of opens the door to improvement. And fear shouldn't be there. There's no room for fear in healthcare. So, what is out there to help us navigate these challenges that I talked about? Accreditation. And I think, yeah, it's obvious that I'm going to say this. It is accreditation, and it truly helps. And I witnessed this firsthand. So Wendy already covered this, but I'm just going to repeat myself. Introduction to accreditation and quality in healthcare. So what really is accreditation? And I think we can define it as a formal evaluation by external body, then that organization meets specific standards. Simple as that. And it is a quality improvement process, and it seeks to improve patient care and outcomes. And it does so through systematic review. So when we have these surveyors on site, they looked at everything. They do systematic review of area against the standards and criteria in the standards, and look to implement a change. And healthcare accreditation, the definition, it is a process, like I said, of external review of the quality of the healthcare being provided by the healthcare organization against a predetermined set of standards. So as I said, accreditation, any accreditation body would have its set of standards. So you as a service, you would follow it and make sure that you put things in place. And when the surveyors come on site, they would do the lovely reviews, systematic reviews, and make sure that you do follow these standards and the things are in place. And they will always look for evidence. And this is what it means when I say there's a difference between services who are accredited and not. I witnessed firsthand when inspector, your regulatory body inspector comes on site, and I'm talking this about Ireland, okay? And I do have roots back home, and I can tell you the situation back home in Croatia is even worse than it is in, just things. I think situation back on Balkan will be completely different, and it would just be 20 years, situation will be definitely back when it comes to accreditation and the patient safety. There is a difference. And regulatory bodies, they'll make you, they'll make sure that you do follow your standards, you do follow your frameworks, you do have safe systems in place. And I'm not saying they won't, they will. And they will be tough and they make sure, but I always say it's kind of a minimal standard, at least it feels to me. You have to achieve these minimal standards of care, of safety, what's acceptable in the terms in terms of healthcare and quality of standards worldwide. But when it comes to accreditation and being accredited, is actually an extra layer or extra safety net around your system. So it's like you're adding these extra steps of quality and safety, extra layers to making sure that your services and organizations are safe. It's just strengthening the whole process a bit more. It's kind of bulletproof. So yeah, that's what accreditation means to me. And as I said, I had experience firsthand, so I'm pretty convinced I'm just about right. My computer is not working. Okay, so how can we define quality? I found a few definitions here about quality, and I kind of like them all. And the reason why I put them few is that you can actually see, regardless who defines it, regardless of the body or wherever I picked up this definition, they all pretty much talk about the same thing. So I was like, yeah, I'm just going to put few so we can actually just walk through them. Institute of Medicine, they're saying that the degree to which healthcare services increase the likelihood of desired health outcomes are consistent with current professional knowledge, and that's quality to them, right? National Academy of Medicine is saying quality healthcare is care that is safe, efficient, patient-centered, timely, efficient, and equitable. And then the Federal Agency for Healthcare Research and Quality says doing the right thing at the right time for the right person and having the best possible result. I really like this one. It's really easy to mirror. But you all agree they're all talking about the same thing: patient safety and the highest possible level of care and for the patient. So minimizing the risks and encasing care for patients. So we can define quality as degree to which a set of characteristics fulfill requirements, right? and it is objective and subjective in nature. And according to World Health Organization, quality of care is the level of attainment of health systems. And what that means is the intrinsic goals for health improvement and responsiveness to legitimate expectations of population. And I think if you break down your quality, if you kind of break it down into, just simple terms, what it means, and the kind of core of it is how do you provide your care to your patients in a safe way, and at the same time making sure that the level of care is up there, the highest possible level of standard patient safety, what we are trying to achieve. So combining these two and minimizing the risks and just having the best possible outcome, it really is the core of the quality, regardless of the country you work in, regardless of the language you speak or the national standards that are in place. We all look at the same thing. And when I do my compliance training at work, people are not really familiar with the accreditation, and I always find that staff on the ground takes a while to understand what accreditation is and what quality really means. And when we did a bit of a survey and we talked about the difference between quality, and in Ireland we have HIQA like regulatory body and quality with accreditation body. What is really the difference? And that was not a trick question in a survey, but we just wanted to understand what's their understanding levels of quality in healthcare and what does really accreditation means in it. And they couldn't answer it. It was actually it was a bit surprising for us first year when we kind of started doing this. And I think because they just couldn't comprehend the difference. To them, it was different, but in terms, it just wasn't. So when I do my training, I'm always trying to break it, regardless who we are accredited with, or what the regulatory body is, or how do we define quality, or language we use to define quality, or country you're all coming from. We can all agree that a quality core of quality is same, is the patient care and the quality of it. And it's simple as that. So yes, there are always the standards around it, and the things that, quality initiatives and accreditation might have different additional steps to achieve, and then regulatory body, but they all talk about same, national governing body in here, or one in, I don't know, Asia, or other countries out there, Austria or whatever, they might have different bit of standards, or they might translate it different, but they're all going to talk about the same thing. And I always try to put this across the line with people on the ground. And when you put it in simple terms like that, it truly does make a difference, because there's no difference. Accreditation in the national governing body and accreditation, they're all about the same thing. So yeah, quality, to me, quality will be the same regardless of the language or country. We all look at the same thing and trying to improve the patient care. So how really accreditation ensures patient safety? And I really like this next few slides. I'm trying to adjust my computer, so excuse me. So breaking it down into what accreditation means for service, what accreditation means for patients, staff, and communities. And I think when you really do break it down, you can see the benefits of it. So we can start with benefits to, sorry. Okay. So how accreditation ensures patient safety? We have standardized processes, and this one really is the key, especially between the departments, between your sites, hospital sites, clinic sites. You would have these big hospital groups with different probably sites in each state, clinics in a different cities. So if you all fall into one group, I think it's much harder for them than for one set hospital to achieve standardized practices, because we have different people, different cultures, different parts of the city, different understanding maybe of standards. So how to achieve this, and accreditation really helps. And the organization I work with, we have 3 different sites, right? And we always find that every time there's a new process in place, it takes time to adjust them between 3 sites, because they all just interpret it differently. You have different people in charge there. Even though we all meet at the same time, it just takes a while for things to settle. But accreditation really helps us in that way, because we put system in place, so they all just need to follow the system, right? But it takes time. But without the system in place, it would be really much harder. So standardized practices are the key, ensuring consistent practices across department, and they will help you reduce the errors. Accountability, encouraging accountability. Accreditation really does encourage accountability and commitment to continuous improvement. And I talked about this before. Risk management, it helps identify and mitigates risk to patient safety. It pushes for staff training and empowers the staff training and requires you to produce the evidence of continuous education in patient safety protocols. And monitoring and evaluation, regular assessments, your KPIs, your reports that you have to produce. Yes, some would be required by a regulatory body, but accreditation has that extra little requirement of certain reports that you have to produce on annual or quarterly basis. And that would just kind of strengthens your patient safety processes within the facility you work in. So benefits of accreditation, as I said, benefits to patients will be continuity of care. I think we all agree the main one. Focus on patient safety, or for example, pain management. Patient satisfaction is evaluated. All the surveys that we do, you have to do annually, for example, even the patient and their service and we also do for our staff and their families and visitors. So you evaluate your services through their opinion and statements, and rights are respected and protected. Access to quality focused organization, credentialing and privileging medical staff, high quality of care, and understandable education and communication to your patients and staff. Apologies there. Benefits of accreditation to your staff. As I said before, it improves professional development. It truly does. You have to have these dedicated, educated, specialized people in place, provides education on consensus standards, provides leadership for quality improvement within medicine and nursing, and increases satisfaction with continuous learning, good working environment, leadership, and ownership. And one thing I've noticed is your quality initiatives. Your quality initiatives will push your staff to train additional new skill. You put a new software, you put a new practice in, new quality program in, and you will train your staff. It might not be external training, something quick internally to build their skills, to improve their skills. And it pushes them. And it's same for us. I think you would all agree that stagnating in a place and not pushing yourself and not really, improving on your skills or learning a next new skill, uh, just there's no joy there. It doesn't make it interesting. You kind of start losing interest in that workplace. So I would say to a certain level, accreditation does help maybe to retain your staff through the level of continuous improvement and education of them. They're being pushed each day in a good way, just to kind of be better version of themselves. And I truly think that there's just a bit more joy in the workplace where there's always some quality initiatives trying to improve services. And I truly think they're just tiny bit happier in that place than the place they're just like stagnating for years and there's nothing new happening. And I think that would happen to all of us. So it truly does increase the satisfaction. Benefits to your organization and a community. Higher quality standards. Accreditation demonstrates a commitment to meeting national and international standards for healthcare quality and safety. And it truly does. You do have quite higher quality standards. And I already said it's like a little extra safety net around your processes, just a higher level of standard that you apply in your organization. And it truly does demonstrate that because there are extra set of standards that you'll go through and implement. Enhanced reputation and confidence, it does raises community confidence and it can actually attract more patients and more skilled professionals. So personally, it would be very hard for me to go back to organization that's not accredited. Personally, for me, if I was to change the workplace, it would be very hard because you get about money, but what can we do to improve the service? What can we actually do? Oh, we actually have to come up with a few initiatives this year. Okay, how do we do this? Places without it, there's just not that much proactiveness, and that's what would kind of probably drive me a bit mad. So it will be very hard for me, and I would always look to work in the organizations who are accredited. Reduce cost and increase reimbursements. Sometimes, at least for us, our insurance, our premium is a bit lower because we are accredited. And that just because even insurance insurance people know that having accreditation means you're just a tiny bit safer, right? And strengthen resilient systems. Accreditation contributes to more resilient healthcare systems by improving resource allocation and fostering innovation. It will push you to make sure that you're using your resources smartly and efficiently. So the long-term impact would be strengthen organizational culture of safety. It does. Like we went through it, and I think you would all agree, higher reputation and credibility in the community and eligibility for partnership, funding, and insurance recognition. And I think these will be the kind of top three for me, the long-term impact of accreditation. So conclusion, patient safety is at the heart of quality healthcare. Accreditation ensures consistent improvement, accountability, and together they build safer systems and better outcomes for all. And they do go hand in hand. And I think I already covered this. Patient safety and accreditation really do go hand in hand. And it's building those safer systems to make sure that patient safety, that systems are there for patient safety. So yeah, that would be all for me. Yeah, no, I'm done. So if you have any questions, chat boxes, I'm sure you can use a chat box.
And we just thank you, everyone. Thank you, Antonia.
Exactly.
Appreciate
Thank you,
it.
everyone. Thank you.
Thank you all
Uh,
for attendance and interaction. If you have any questions left, if you have any other inquiries, you may email us on the email that already you have seen it, or WhatsApp us, or leave your email. We'll get back to you. Thank you all. Thank you, Antonia. Thank you, Wendy. And thanks to me as well. And see you soon in our upcoming events. Thank you so much.